When I learned about Legacy, I felt like I had really learned something unbelievable for our city.
Legacy started as an STD organization to help people. When AIDS came about, it became very difficult for everyone with people struggling to live. I felt that Legacy had the commitment to keep moving forward, and obviously it's manifested itself, and it has.
In the early 80s, they created a system of care to handle a very finite population with a very specific issue. As that issue has become less acute, they've been able to use that same model of care in other ways to reach other parts of the community as well.
Even though I'm a legal citizen in this country for the past 10 years that I've been here, I haven't been able to have a health plan or health insurance, and I feel that I can receive care from Legacy, and I'll know that it's affordable.
The people that are served by Legacy are not people who aren't participating in society. These are people who are part of our community. They may be artists, they may be caregivers, they may be service industry people who are contributing, earning a living, doing a job that's important to all of us, yet they're not in a situation where health care is readily available to them.
Legacy takes care of the ongoing things that happen in family life that don't require you to go to a big hospital to the emergency room.
I think that what happens when people don't have health care is that they don't take care of themselves. And if you think about the African American community, the Hispanic community where Legacy has just opened clinics, hypertension and diabetes are rampant in those communities. Those are both diseases that are very treatable if they're caught early and if they're treated. Left untreated, they cause heart attack, stroke, blindness, situations that are much more expensive to treat and much more expensive to handle.
Legacy does a tremendous job in what they do for families and individuals. I think they provide a much, much needed resource for families that don't have the financial means to get quality health care for their families, and it's something that we need to expand on.
The atmosphere of the clinic was what really made me feel comfortable. I was able to speak to them in Spanish. I was able to communicate better with the physician, with the staff.
I've never seen such caring people. All the people that were working in there were smiling, and they said, "Can I help you?" And it was like they couldn't wait to help the person that was stepping up to the window. That's so important, to feel like the person you're talking to is glad that you're here.
They do cater exactly to what I need. They know what I need before I even have a clue. And between the dietitian, the psychologist, and optometrist, everything was coordinated. And it's great to come in and have that.
Part of the growth of Legacy is the fact that they have these clinics, there are people with needs, they can treat all kinds of issues in those areas and still continue their mission to treat HIV/AIDS.
What we really like to do is understand the dynamics of the community and provide the right services that helps build a healthier community. We don't just provide health care at the Southwest site, we provide educational opportunities.
You have everything in one place. You come and get your health care here, and your kids, they have different programs, and parenting classes help you to be a better parent and to kind of understand more your kids.
I got to see a lot of little babies nursing, and the mothers were so excited because they had healthy babies, and I think that Legacy is helping these young mothers so they can feel confident that they'll have well babies.
I had my little boy. He's a healthy big baby. I took him to PD to get his vaccinations and his checkup. They're very nice with the kids, and I really like it.
Our other clinic is in 5th Ward. We do a lot of geriatric care there, general primary care, and we see a lot of children at that clinic.
Legacy, placed in all these areas, is a godsend to these people because it takes care of that portion of their life.
The other incredible thing that's going on is we're finally broken ground and starting to build our new building on California Street in the Montrose neighborhood. 40,000 square feet, double the size of what we have now in the area. And we're going to serve so many more people. We're going to have 3 times the clinical space that we have now, quadruple the parking, which is a big issue in Montrose. And it's going to be a beautiful, ultra-modern, very state-of-the-art clinic. And I can't wait for it to open.
When you spend as much time supporting an organization as I do, you do think about what their future is. And I'm very excited about their growth. I'm very excited about the prospects for their new building to be able to centralize their functions and provide space in their satellite clinics for more care and more patient services.
I feel like that I have been blessed all of my life with good health and with good doctors. I cannot imagine what it would be like to know that I could not go to a doctor. And I feel like God has given me resources, He's given me time, and He's given me talent. And this is what I plan to do now, is to help others who are in need of help. And I'd like to lead the community and get other community leaders involved. It's not how much everyone gives, but if everyone can give a little, there's no end to where Legacy can go and how many people we can help that cannot help themselves.
You have to raise your children and your family with that mindset that if you have been blessed in life, it's your obligation to give back. And Legacy is certainly an organization that allows everybody the opportunity to get in and help.
There's no way I would have ever dreamed of what our legacy has become.